Hi, my name is Davy Murray, and I'm the Michigan State Facilitator for Delta Sigma Theta Sorority Incorporated. Now it's time for action, and I want to do my part in help ending maternal disparity. What legislation can be used?
We need to extend Medicaid through the first year. We need to make sure that people have health care after they have their baby. So Medicaid pays for more than about 40 to 50% of all births in this country. And a lot of folks are going to not have insurance after 60 days. And so if we know that heart disease, cardiovascular problems, hypertension are things that are killing people in the first year, well, that stuff doesn't go away in a month or month and a half, right? So we need to make sure that this mom, if she had hypertension during her pregnancy, that she has someone who's checking on her early postpartum, not wait until 6 weeks, somebody who maybe is even coming out to the house to check on her. We need to make sure that she's connected with a good family physician, because as her midwife, I might not be the person who's gonna monitor her blood pressure over her lifetime, but maybe I can hand off to a family physician and make sure that she's either on medication or that she starts to be able to do some wellness activities that will really help.
And then reimbursement. Health insurance needs to reimburse all forms of birth, not just hospital-based birth, but home birth, community-based birth center birth. That needs to be reimbursed. And then of course, doulas reimbursement. Nobody should have to choose between a doula and a crib.
Recently, there is the Maternal Health Omnibus Act of 2021, which was introduced by Representatives Lauren Underwood and Alma Adams, as well as Cory Booker. Within the Omnibus is one of the critical elements related to maternal health, and that is existing legislation to expand the postpartum period to 12 months, which is the 1 year after the mother gives birth, and that will help with support services that are needed. There are efforts related to growing and diversifying the workforce in perinatal care so that our workforce also represents the patients that we take care of as well. Improvements in data collection, which is critical, because if you don't have the accurate data related to maternal and infant mortality and the groups that is impacting the most, you won't have the programs there, you won't receive the funding that is needed. So accurate data is clinical from that vein.
I think that we should have much more accessibility to mental health. When I have a patient that might have a crisis after pregnancy, I have to literally take that patient's word that she's not going to hurt herself or the baby. But I'd like to get her in to see someone as soon as possible. I think that will help a lot of people with postpartum depression, postpartum psychosis, and postpartum issues that follow with mental health.